Hi, good day. I'm Aliza Lyons and today I'll be doing a presentation on shock. Today we'll be talking about three types of shock: distributive shock, hypovolemic shock, and cardiogenic shock. First, let us give a definition of what is shock. Shock is a life-threatening condition that is inadequate tissue perfusion, right? That can lead to dysfunction and damage to the organs, right? Normally, shock normally lead to hyperperfusion like altered mental status and difficulty breathing. At this time, we're going to break down the shocks individually. I will start by we will be discussing distributive shock. Distributive shock is also called vasodilator shock that can lead to a widespread of vasodilation, right? With distributive shock now, that can lead to hypovolemia. That means if the patient if the patient have a normal blood volume, with this now, the patient blood vessels start get relaxed. That make it harder for the heart to circulate the blood to the vital organ. So that means it make it a work, right? So it can't circulate effectively. The patient would present with a skin condition, right? Then skin condition at first it would start get warm and flush, and then after it start get warm and flush now, then it start get cool and clammy. With distributive shock in a one patient, them also become hypertensive, them start get tachycardic, them also would have them cap refill would have be normal or it would have be brisk, right? And then also with distributive shock now, the patient would either have a altered mental status or they would have become tachypnea. In discussing distributive shock, with distributive shock it comes with some family. You know, everybody have one like a generation go down the line also. So distributive shock has its own generation. With distributive shock now, the generation with distributive shock now, you'd have septic shock, you'd have anaphylaxis shock, you'd have cardiogenic shock, and you'd have psychogenic shock, right? We are going to talk about them individually. Septic shock have to do with infection. You can get a fever or hyperthermia. With septic shock too, you even can get, you can be in a hospital and you get one cut. And so for example, they not treat it same time, like they not give blood thinners or nothing for a clotting or so, you can develop an infection from septic shock. Then now you would start have abdominal pain, you would start cough and then something there. Then now we will talk about anaphylaxis shock, right? Anaphylaxis shock, this now would give you rash, hives. Your face would start swell up, or your throat starts swell up, your tongue starts swell, you start have respiratory issue, right? You start either you have difficulty breathing or you have shortness of breath, right? Then now we move on to neurogenic shock. Neurogenic shock have to do with spinal cord injury. With neurogenic shock you can become paralyzed, right? Then now we move on to psychogenic shock. Psychogenic shock have to do with the mind, right? It causes a sudden emotional stress. It's either you fear something, you're in a pain or so. So with psychogenic shock now, patient normally faint with psychogenic shock. However, after the patient faint, when they wake up now, they regain consciousness, right? Then now we'll move on to hypovolemic shock. Hypovolemic shock that now cause a significant reduction in the circulating when the body try to circulate the blood volume. Yeah. It cause the heart to start decrease in volume. So it a full up insufficiently with the blood volume, so it reduce cardiac output, and it give you inadequate tissue perfusion, right? Hypovolemic shock now can cause hypovolemic shock now can cause a patient to have hemorrhage. So the patient can get a hemorrhagic shock. That's when the patient lose a lot of blood, and also you have a non-hemorrhage shock, right? That with that one, the patient lose plasma, so then start vomit, they have diarrhea, and then become difficulty dehydration. Patients like this would have present with a skin condition too. Then skin would have get cool, then would have get pale, then would have get sweaty. You would have call that diaphoretic. Then can become hypertensive, then have a high heart rate, and then cap refill would have delayed. Then would also have a altered mental status, then respiratory, they have respiratory issue and dry mucous membrane. These patients too can have dehydration. Now we will move on to cardiogenic shock. Cardiogenic shock happens when the heart is pumping. The heart's pumping ability decrease, and that would cause it to damage. Would it cause it to damage now? You can get a cardiac output, even through an inadequate blood volume. So the blood volume is not as high, and the heart cannot pump enough blood for cover the whole body demand. So the heart will work, but the body not go with it, right? Things we can cause this as is like a acute myocardial infarction. We call that AMI, right? Them can have a severe heart attack. Patient we normally with cardiogenic shock now, them can have a heart failure, them can have arrhythmias. These patient now would have a skin condition also. Them would have high heart rate, they would have hypertensive, them cap refill would have delayed, and also they would have altered mental status. These patients also would have respiratory issue. They would have JVD, jugular vein distension, and auscultation. You would have ear rails and swelling to any part of them lower extremities, right? In the field, we EMTs, we normally, for patient with any type of shock, we suspect shock, we make sure maintain the patient's airway. We provide oxygen as needed. If the patient bleed, we control the patient bleeding, right? Rapid transport with the patient to the hospital and cover the patient with a blanket and make sure so the patient is lying supine. We monitor the patient vitals and we reassess the patient. If the patient is stable, we reassess every 15 minutes. If the patient is unstable, we reassess every 5 minutes. With these type of patient now, with giving them oxygen, we give them via either nasal cannula or non-rebreather mask. And that is the end of my presentation. Thank you.